Hi, everyone, and welcome to today's session on providing extra spoons for those with chronic health conditions. My name is Kat, and I am the manager of Global Peer Support here at Mental Health America. My pronouns are they, them. Um, and before we begin, we are going to just cover some housekeeping announcements. It also just gives everyone else a chance who's trying to enter the webinar. Um, could you just turn to the next slide for me? So this session is being recorded and will be publicly available within 1 week. The recording will be emailed out to those that registered for today's webinar, and it will also be available on MHA's site at mha.national.org/webinars. We do not offer CEUs, but if you would like a certificate of attendance, we have a form for you to request one, and we will post a link to that form in the chat periodically, so do look out for that. And it will be included in the follow-up email as well with the recording of the webinar. We have provided closed captioning for today's webinar, so be sure to enable it by clicking the closed captioning icon at the bottom of the screen. And finally, we should have some time for audience questions, so please post your questions in the chat box throughout this webinar. So one of the things I like to do for our webinars is I just like to set the container that we're gonna talk or have this webinar in. So, one, we are not clinical mental health professionals, but we are persons with lived experience of mental health conditions and chronic health conditions. We really invite persons to be aware of privilege and systemic oppression of historically excluded communities, particularly BIPOC, LGBTQ, persons with mental health conditions, persons with disabilities, etc. And we welcome persons to have curiosity and remove judgment on self or others. And I really also want to invite persons to hold a lens of compassion, care, and empathy for others as well as yourselves. So this could mean, stepping away for 2 minutes because Zoom fatigue is real. So whatever you need to do to take care of yourself, you're encouraged to do so. So to set the container of this conversation in particular that we're going to have, we recognize Human Rights Day today. This year, Human Rights Day relates to equality, and Article 1 of the Universal Declaration of Human Rights, which says that all human beings are born free and equal in dignity and rights. So, just taken from the United Nations website about human rights, it says that the principles of equality and non-discrimination are at the heart of human rights. This includes addressing and finding solutions for deep-rooted forms of discrimination that have affected the most vulnerable people in societies, including women and girls, indigenous people, people of African descent, LGBTQ, migrants, and people with disabilities, amongst others. So, for this webinar, we want to remember that it's important to promote and advocate for human rights for all, as well as to create practical solutions to address them. And that is why it is my pleasure to introduce you to our presenter, Timber Talbot, and have them share how they are implementing practical solutions to address human rights needs for those with mental health conditions as well as chronic health conditions. Timber, who uses they them pronouns, is the founder of Extra Spoons. Timber is an American mental health advocate and community activist who founded Extra Spoons. Timber's mission to promote mental health awareness has spread internationally among multiple online platforms, sparking intra-community strength, self-advocacy, and grassroots mutual aid. Timber recently left their full-time career in the professional healthcare setting to shift focus on their goal of advocating for underrepresented people with mental health support needs. And I will hand over the floor to Timber.
Thank you so much. I appreciate that. And thank you so much for having me here today. It's a huge privilege and honor to be able to speak about my organization. I did want to start by talking about the upswing of the mental health crisis in the United States during the COVID-19 pandemic, and primarily how it impacted some of our communities in our country and how this became a call to action for mutual aid in social networking. So during the COVID-19 pandemic, um, the World Health Organization had developed a stress management guide for the general public, and that included guides for COVID-19 responders, and that was on basic psychosocial skills and toolkits to help older adults maintain mental well-being. And the World Health Organization continues to launch mental health programs over the next 9 years in response to emergency situations that involve mental health. Now, there were some major stressors involved during the COVID-19 pandemic, and those included the fear of contracting the virus and the fear of loss of loved ones, unemployment, financial instability, intimate partner and family violence, and working through the pandemic conditions, as well as social isolation and loneliness. There was a survey taken by the World Health Organization, and 31% of adults who were surveyed reported having symptoms of anxiety and depression. 20% reported stress related symptoms. 13% reported new or increased substance abuse, and 11% reported serious thoughts of suicide. Now, these numbers were double what they had been prior to COVID 19. Chronic conditions after traumatic events are more likely to remain chronic if somebody does not have a reliable support system. And some of the symptoms that can appear directly after after a traumatic event would be distress, new or worsening symptoms of depression and anxiety, and insomnia. And they can become chronic due to poor social support, financial difficulties, food and housing instabilities, and history of mental illness if somebody already has mental illnesses. The National Institute of Mental Health reports that in the immediate wake of a traumatic event, such as the pandemic itself, um, people had reported all of these symptoms, and many of the reports were indicated that they were symptoms directly related to food insufficiency and the financial concerns and loneliness. The National Institute of Mental Health states that the physical distancing did not mean that we were to stop supporting each other altogether, and that receiving economic or social support or using coping strategies was reported to actually lower the risks of symptoms becoming chronic and also to help maximize recovery. As we discussed a little bit already, minority communities are disproportionately affected by chronic mental health conditions. African American communities, Hispanic communities, and indigenous communities reported increase in suicide, negative impact on mental health related to access to care, psychosocial stress, social determinants of wealth, and minimal access to mental health resources. Other communities that have been affected were the LGBT community, and this includes LGBTQ plus youth. 70% of youth reported poor mental health due to COVID-19, and 48% of LGBTQ plus youth reported wanting counseling from a mental health professional, but were unable to receive that counseling for one reason or another within the last year. This is why psychiatric and mental health care needs to be accessible to everyone. Other communities who are disproportionately affected are people with chronic mental health conditions already. People with schizophrenia and other serious mental conditions are 10 times more likely to contract COVID 19 and 3 times more likely to die from it. Meanwhile, autistic people were reported to have their core symptoms worsened by COVID 19, and this was due to upset in routine, upset due to new, different, or elevated hygiene standards that they hadn't been used to before. 20% of autistic people are already diagnosed with anxiety, and 11% already suffer from depressive disorders. And this was greatly elevated due to the pandemic. And this kind of cycles back to executive dysfunction, which is going to be a primary topic of what we're talking about today and where extra spoons comes into play. So, executive dysfunction, if you don't know already, is a weakness in the brain's management system, and that's going to directly affect someone's ability to pay attention, their memory, their organizational skills, time management, and creative thinking. And some of the causes for that are going to be ADHD, autism and other neurodivergencies, obsessive compulsive disorder, schizophrenia, traumatic brain injury, depression, learning disabilities. It can even be hereditary. And I do also want to touch on that stress and sleep deprivation, which were major symptoms of COVID 19, is also a huge factor in executive dysfunction. So this can affect anybody. And executive dysfunction affects your day to day tasks, ability to work or go to school, completing tasks independently, or maintaining relationships. Many people with executive dysfunction have a difficulty completing what would typically be considered a basic task, such as writing an email or making a phone call, brushing your teeth, doing housework. Having executive dysfunction or anxiety also impacts tasks that people already find overwhelming and turn what someone might consider to be a hurdle into a complete blockade. They are completely unable to do it altogether. A primary example of that would be scheduling and setting doctor's appointments. A lot of people are already aware about the setbacks in appointment scheduling due to the way our healthcare system is already set up. I had worked as a referral specialist in a doctor's office, and many of the phone calls that I had received daily were potential patients who were exhausted and exasperated with attempting to find a specialist provider. Many people had expressed that they were ready to give up and couldn't do it anymore and were afraid that they were going to die because they were unable to find a provider that was within their network or that was within driving distance. Uh, Most people, or many people, I should say, already find these setbacks to be extremely overwhelming. But when somebody has a mental health condition or executive dysfunction, it becomes nearly impossible. Um, People with executive dysfunction or a condition like anxiety can't even make the first step into making that phone call. And the thought of being turned away from care is enough to deter somebody from even trying in the first place. And this is where social networking will come into play. Some of the setbacks in appointment scheduling that I've heard expressed to me have been difficulty navigating and understanding insurance plans, the affordability of insurance, finding providers within a network, or finding providers that suit their needs, such as bilingual or multilingual providers, somebody or a provider who will validate somebody's identity, and also ones that have the appropriate healthcare needs that the potential patient is looking for. Affordable copays and out of pocket costs were also a very primary concern that many potential patients had. And then, of course, the wait time for appointments. Many specialist providers will have a 2 week minimum wait time for an appointment, but when it comes to mental health, it's not uncommon for it to be over 6 months to get an initial starting appointment for a mental health care provider. So, when it comes to social networking for chronic health mutual aid, it has allowed people with specific support needs to reach way beyond their direct peers who they might have a level of self consciousness reaching out to. Many people with mental health conditions feel a sense of guilt when asking for support, and this can sometimes prevent them from asking at all. According to ScienceDirect.com, guilt is associated with many internalizing disorders such as depression, as well as disorders such as OCD. Oftentimes, these extreme feelings of guilt can make a person feel like they're being a burden, especially to family and friends. They feel like their condition might be too much, that their family and friends can't help them anymore, and this will deter them from asking for help at all and taking those first steps. Um, Social networking can help to alleviate these feelings. It'll provide a certain level of distance between the person asking for help and the people who are helping them. And this can make the first steps of getting help a little bit more manageable, especially in a group like Extra Spoons, where the people who are volunteering to help are very willing. They're there because they want to be, and they're very eager to help. Social networking also allows for people to passively watch while people with similar needs receive assistance and allows them to receive assistance by proxy without having to directly ask. So if somebody has a similar request, they're able to search in a group or watch other people get help and utilize the resources that are given to one person without having to take those steps themselves and sort of passively receive what they need. In the case of Extra Spoons, social networking has allowed people to ask for help and all, who are asking for help to actually provide help to other people as well. I'll get into more about how Extra Spoons actually works in a couple of slides. But one of my examples is when somebody goes into Extra Spoons to ask for help, they tend to stay in the group and then help other people with what they're able to help with as well. So, social media has allowed the process of asking for help to be streamlined and gives someone the ability to consult a large group of people with a diverse skill set. So this is a little bit more lighthearted than talking about the pandemic and everyone's struggles, but this is a viral post that had gone around talking about the mom friend override or the social anxiety loophole, where one person might struggle with performing a specific task, such as making a phone call, but they excel at something else, like composing an email or proofreading or formatting a resume. So this person states that their anxiety loophole is if their friend is equally uncomfortable or more uncomfortable than they are suddenly able to perform a task that they were no longer able or that they weren't able to perform for themselves. So the example of that was asking for ketchup. They might not be able to do it for themselves, but if they see somebody else in need, they're very able to do it all of a sudden. So I'd like to talk a little bit about Extra Spoons and what our mission is. As Kat had mentioned, that we are a grassroots volunteer program for mutual aid. We are run and operated by ordinary people, and we took the mental health crisis during COVID-19 as a call to action. Uh, Extra Spoons was founded in 2020, and I had noticed many of my friends were struggling with their mental health and having a difficult time with the many tasks that had been mentioned in the presentation, such as navigating the healthcare system and maintaining routines and keeping up with housework due to depressive episodes. The group is called Extra Spoons as a nod to the spoon theory. If you're unfamiliar with the spoon theory, I have some information on that. And it was founded by somebody named Christine Miserandino. And she had mentioned, here's a quote from her: the difference in being sick and being healthy is having to make choices or to consciously think about things when the rest of the world doesn't have to. The healthy have the luxury of a life without choices, a gift most people take for granted. The spoon theory is an analogy that's using spoons to explain the limited amount of daily energy that chronically ill people have to allot to completing tasks each day. A task such as eating a simple meal might take one spoon, while a larger task such as overcoming fear or anxiety to make a phone call or to go to work for a full day might take 3 spoons. When a person is out of spoons, their ability to perform that task ends. When a person, whether it's the illness is physical or mental or emotional, many chronically ill people have to carefully pick and choose what tasks they're able to complete throughout the day. So once their spoons are out, that's it. And they have reached their emotional and physical limit. This is called running out of spoons. Extra spoons runs on the principle of if I have some extra spoons today, I'll share them with someone who doesn't have any. The group Extra Spoons is how peers provide mutual aid based on soft skills. Many times people will volunteer with professional skills as well, but we would like everybody to have an equal playing field as far as being able to volunteer and as far as being able to receive the kind of help that they need. And it was started because I wanted to apply the knowledge and training that I had as a referrals coordinator to help my friends find the doctors in their network and use their health insurance in a way that had worked for them. And it turned out that I had enough need within my own personal friends group that I had to create a group because there were 70 or so friends that needed help with their insurance. And then they slowly began inviting their other friends, and then that eventually turned into a few hundred people within the group. So, soft skills, that is someone's personal attributes that allows them to interact effectively and harmoniously with other people. And that's going to be things like communication, self motivation, conflict resolution, networking, and time management. So, in order to be a volunteer for Extra Spoons, you do not need to have any professional background. There does not need to be any training, any work related skills that you have. If you can make a phone call, if you can write an email, or if you just find yourself able to have a conversation with somebody, that is all you really need to be able to do to volunteer. Like I said, people also have volunteered their professional skills, such as resume writing, but that's not a requirement. Now, as I had mentioned, the group had grown to a couple hundred people just based on word of mouth alone. But I'd found, let's see if I can get this slide to work. This will be the fun part. This video here. And so if we want to take a minute to watch and see if I can.
Timba, I don't think we're hearing the sound for the
Okay.
video.
Okay. So unfortunately, we don't have the sound for it, but I'll briefly explain what it is. And if you would like to view this person's TikTok account, her watermark is down at the bottom, but it was a video that showed somebody, and it was based in comedy and it was hashtagged as comedy, but it showed somebody what it was like to make a phone call as an adult with anxiety. And while her voice is cheerful and happy and very, very polite, she is, as you can at least see in the picture, emotionally distraught and crying while she's trying to make a phone call for her hair appointment. I had stumbled upon this video, and as you see now, or I don't know if you can see it, it has 14 million views. And in the comments were thousands of people mentioning that they struggled making phone calls for making appointments. And it was all due to anxiety or other mental health conditions. People said that they would hang up the phone and not remember the time that they had agreed to, that they didn't remember any of the conversation that they had, or that they would have just selected a time altogether for their appointment that actually didn't work out for them whatsoever because they were in such a panic because of their anxiety. And so, like I said, even though it was tagged as comedy, the comments were full of people that were actually desperate for help, saying, I have such bad anxiety, or hey, at least you made it to picking up the phone. I can't even do that. And so I had ended up duetting this video on TikTok. If you aren't familiar with TikTok, it's where you can make a video reply. And I responded to the video offering to help people make the phone calls because that was applicable to my skill set that I already had because I spent 8 hours a day on the phone making appointments for people in a doctor's office. So within 24 hours, my inbox had exploded with people asking for help. And I said, oh boy, let's move this to the Extra Spoons group. I had plugged the Extra Spoons group and said, hey, this is available if you need help. And the next day, the group suddenly had over 6,000 members. And I had realized that between the patients that I had spent hours on the phone with that would call me in tears begging for help because the doctors in our area weren't taking Medicaid, and between the people that had been commenting and in my inbox, that this wasn't comedy and it was very, very real. And it was actually a need that people had. And a mutual aid program was something that needed to be put into play. So, the mission for Extra Spoons is to promote accessibility and advocacy for chronically ill people who may be overlooked by systemic bias. Our mission is to help each other overcome as many as the hurdles that are put in place by getting through the difficult first steps of asking for help. And of course, also to end the stigma of getting help for any mental health or chronic illnesses that people may have. From day one, Extra Spoons has always been volunteer based. There is no form of exchange, no compensation, or no payment for any form of support requests. We believe that the copays and insurance costs, the out of pocket payments, as well as the wait times for appointments, the driving distances, and the racial and gender biases of the healthcare industries have made unjust and unequal inaccessibility in mental health care for many people in the United States, and as well as the rest of the world. Extra Spoons is actually international at this point, but other countries do have different healthcare systems than we have, so it is more US centric. We're not a replacement for any kind of professional health care, but we are there as a tool to help with executive dysfunction support and to help assist people in taking the first few difficult steps and getting the help that they need. So the CDC and the National Institute of Mental Health and numerous other government agencies and nonprofit organizations have been spreading the message that physical distancing doesn't mean that we must stop supporting one another. In fact, research shows that helping others is a coping strategy that can reduce the mental health impacts of the pandemic. And this was actually quoted by the director of the National Institute of Mental Health. And I really have taken this to heart, because even if you have to help somebody from your own living room, and even if you can't help somebody financially, the ability to pick up a phone or send an email, if that's something that you can do, has proven to help at this point 16,000 people. My personal statement has been, if a phone call is what is standing between someone and life-saving care, then I'm going to make the phone call. I eventually began making so many of these phone calls that I chose to change my career path altogether to become more available as the founder of Extra Spoons. And so I would like to talk a little bit more about how Extra Spoons actually works so we can get a good idea of it if anybody's interested. So once a request is made, anybody in the group is able to help volunteer as needed, and the person requesting support is able to choose who they would like help from. Any further communications that would include personal details is moved to a private conversation, and that is for the safety and privacy of whoever is requesting. Extra Spoons does not allow any legal or financial advice or medical advice, again, for safety reasons. So when requesting support, somebody just needs to adhere to the basic posting format, and that's going to include the type of support needed, such as help writing an email, making a phone call, or something such as body doubling. Body doubling, if you're not familiar with that, would be getting on a video call with somebody and being um, kind of held accountable in a way. So one of the examples for that is, will you please help me organize my closet and just chat with me while I do it so I don't get distracted, and just kind of give a little bit of encouragement. And that's a very common request that we have. We just need them to give their time zone and the time frame that the request needs to be fulfilled by, such as, I need this email sent to my professor by tomorrow to extend a deadline for me. As far as volunteering goes, we do have a volunteer database form, and all that you have to do is fill that out, and it goes into a searchable database, and to include availability, the time zone, and the type of request that you're available to help with. So if you have a specific skill set that you would like to volunteer, you can go ahead and put that in. Um, like I said, it's put into a group database that's accessible to everybody in the group and only in the group. It is private. Or if you'd like to volunteer but not have your specific information put out, you can just become part of the group and you can help on a post by post basis. So if you see something that catches your eye that you think, I would be able to help with that, you can go ahead and jump on that post and comment that you're available. And then whoever is requesting support is able to choose who they would like help from. Some of our common task requests are finding doctors in an insurance network, calling to make or cancel appointments such as healthcare, hair or cosmetic appointments, etc., emailing jobs for professors, body doubling, as I had mentioned, via Zoom or FaceTime for accountability, and filling out forms and documents. Our group, this is what it looks like if you search for it on Facebook, and a link for it will also be provided. And as you can see here, it is a private group. When this screenshot was taken, we were at 16.3 thousand members. It is not able to be seen. None of your posts are able to be seen. If you're in the group, it will not show up on your timeline if you're using Facebook. So you don't have to worry about any of that private information going out to anybody on your friends list. And we also do offer a Discord server. I know a lot of the younger generation does enjoy Discord, and it also does not require a Facebook account to use. The Extra Spoons Facebook group does require a Facebook account. The Discord server does not. There will be a link for that provided as well, and that just requires you to use your Discord tag. And this one is a little bit it's a little bit more instant, and we do allow more advice and general chatter in the Discord as opposed to the Facebook group, which is a little bit more streamlined and task specific. So if you're interested in the Discord group, that is also available. And I do have sources available if anybody would like that for their slides, but that does conclude what I have for today. And here I have my contact information. If you should need to get a hold of me for anything, you can email me at extraspoonsmutualaid@gmail.com, and any kind of inquiries you have for me can go there. And I'm also available through Instagram and Facebook.
Thank you so much, Timber.
Thank you.
So we're gonna be taking some questions. I know we have a couple questions already in. But if anyone, has any more burning questions that you want to ask, feel free to post it now in the chat. So the first question really, someone was asking, you were talking about like social networking and whether that social networking is just social media groups as a whole, or is it something else that you're trying to define?
Right now, as far as Extra Spoons goes, we are mainly on social media, but as mentioned by the director of the CDC, as support does not have to just be social media; it can be social networking altogether. Um, and that's as much information as I would have on that. Our group is, nationwide, so I haven't done any like footwork locally, if that's what you're talking about. But this is mainly through social media.
Great, thank you. So another question that came in was, when you were talking about executive dysfunctioning, someone in the chat was asking about the impact that trauma history has on executive dysfunctioning, and that's something that I, as well, really try to help people to understand. Cause so, would you be able to give like your perspective on just the impact that trauma on a whole has on someone with executive dysfunctioning?
Trauma. Yeah, absolutely. So trauma is a major, major cause of executive dysfunction, considering many of the symptoms that people have from post-trauma. From the slide that I had previously, that was talking about trauma just from the pandemic, but that encompasses all trauma together, not just from the pandemic. That was just an example. The pandemic was an example of a trauma. Trauma overall, including post traumatic stress disorder, executive dysfunction is a huge, huge comorbidity with post traumatic stress disorder and other traumas. So, yes.
Yeah, definitely. And I think that, my curiosity is always the fact that so many of us have experienced trauma in one form or the other, and therefore so many of us are living with the after effects that comes with that trauma. And I don't think that we talk about enough
Right.
how executive dysfunctioning is one of those after effects, right? Just to be on a phone call with someone, or just like to remember short-term memory of like I went into this room for something and I absolutely can't even remember what I went for, so I
Right.
think it's really important to highlight that.
Absolutely. And trauma does have an impact on memory.
Yeah.
Trauma has a huge impact on memory altogether, and that is part of executive dysfunction as well. And just we don't help just people with executive dysfunction. That goes with social anxiety, memory issues, everything, any kind of chronic health, the PTSD, the trauma, all of it. If it's I'm anxious because I can't make this phone call because I'm anxious, that's fine. I can't send this email because I have anxiety, that's fine too. That spans just beyond the executive dysfunction. But yeah, the memory loss. I mean, trauma and memory loss go hand in hand.
Yeah, definitely. So I guess this one was more of a less of a question, probably more advice if you haven't thought about it. They were asking whether you considered connecting with college officers that focus on disability and disability rights to inform them of your program and to, to partner with them in that way. And I think that's a great advice as well.
Yes, I'm very interested in doing that. I actually recently went to the Sarasota Arts College. I was there for their gala for World AIDS Day, and some of their youth, they have their youth program and their youth artists, and so I tried to make some connections there with them because some, as mentioned, especially the LGBTQ plus youth, really had a need for trying to get those first steps in on getting the mental health care that they needed, especially post pandemic. So yes, for the colleges, absolutely, that's a huge need, and a lot of the things that we ask are, please help me. I'm so anxious about my attendance. I'm so anxious about messaging my professor for asking for an extension on a deadline or my absences. So definitely, yes.
Wow, that's amazing. And I imagine there would be so many other different communities that you also can connect with to do this, right? Because like
Sure.
I I'm very curious, sometimes if organizations that provide services really consider the I don't want to say inability, but the limits that their service users have when just engaging, with them. So your organization for me seems to serve like that middle person to say I can be there to like bring both of them together.
Right, right. Because some of these colleges or organizations or jobs or careers or whatever have resources, but getting from that point A of the person who needs the help to the actual help, there's little steps that need to be taken in between there that sometimes just aren't accessible to everybody. And things like the primary example that I can think of is how difficult it is to get any kind of social support, government support, how difficult it is to navigate those websites, or how overwhelming it is to fill out a form for SNAP or EBT benefits, and just the absolute, like, I've had to do it before, and the absolute shutdown. I mean, the while yes, those resources are there, getting them is so hard, and
Yeah.
just it's so overwhelming. It's overwhelming for everybody, but then you add chronic health conditions into it, and it becomes almost impossible.
Yeah, definitely. Temba, I'm curious, like since creating this organization, what would you say is the number one, I guess, positive thing that you feel like you've gotten from like helping people in this specific way?
So I'm not even going to speak for myself on this, because it's not me helping people. I mean, like, yeah, a little bit, but my favorite thing is to see when somebody says, "Hey, I came here for help, but I'm staying to help." And like, I understand everybody can't do that, and I don't expect them to, and that's not an expectation. It's not a requirement. But like, I have trouble with A, B, and C, but there's other things that I can do. And I love it when people say, "Hey, I joined this group because I really just couldn't make this phone call, but I stayed." And I see them, like, I don't keep too much track, but like, I see the same names pop up and I see that they stay there and they chime in, and I'm like, "Go, baby." Like, yes, yes,
Oh
you're
wow. So
doing it.
it's like its own budding community that just
Yeah.
like, yeah.
And and like, when I say mutual aid, like, I mean mutual aid. Like, it's mutual. It's so good. And it was the pandemic and COVID. It was so hard, and there was so much isolation, and just I we were calling it helping people from our living room, because it was a time where you couldn't
Mm.
leave your house. You couldn't leave your house, and just that little spark of like, oh, I'm doing something good.
Yeah.
I'm sitting here at home, eating my chips, and I'm like, I can make a phone call. I can do that. I can help this person. It gives you that little boost of like, yes, yes, I helped them. Yes, they did it. And when you see that request get fulfilled and it says fulfilled, it was done, and you're like, you're rooting for them. I'm rooting for you guys.
Yeah. So just another question that we have in the chat. I know you said that Extra Spoons doesn't provide like legal or medical, that kind of support.
Right.
So how, like, I guess we're curious, like, how do you redirect that? Like, do you redirect it to another agency? Like, how does that process work?
Sure. So we have that disclaimer before the group is even joined. Um, there are check boxes that have to be filled out prior to joining, and those rules are agreed to, and that is part of the contingency of joining the group. And there are keywords that are flagged. So if somebody is asking for that kind of help, we do just try to redirect it, because it is a safety thing for the person that's asking, and also for the people in the group altogether. So we do try to redirect it, and we sometimes try to find, um, if it's a legal thing, we try to redirect them to maybe lawyers in their area or something. So we'll say, we can help you find lawyers, but we cannot offer you legal advice, or we
Right.
can help you find a doctor, but we cannot offer you medical advice, so on and so forth.
Okay, yeah, that makes complete sense.
Right.
Um, so in addition, I guess, people are curious about the bilingual support, support for persons to speak, other languages. So do
Yes.
you all have that service at this point in time?
So we have, it is available.
Okay.
I don't know, or know of it as much because I'm unfortunately not bilingual,
Right.
which is a me problem. But it is something that we are regularly looking for, and I would love to include more of. But that is, as I said, that's a me issue because I'm not bilingual. We are international. We do have people from several different countries, and we do have people from all over the United States that are available. And I should probably add like another language, like translation, and that would probably be, very beneficial to do because that is a very important thing. But I that's something that I need to reach out for help on,
Yeah.
because it's not something that I'm personally capable of doing.
Yeah. So I guess it now is like also a good time to see if people want to get involved with the group and support in this way and have the kind of skills like,
Right.
being able to offer bilingual support, how can they connect with you in that way?
Right. I have my contact information here available. I have the Extra Spoons Mutual Aid. I can be contacted on Facebook or just joining the group altogether if somebody is bilingual, and offering services and saying that and signing up through the volunteer form or making posts. That's perfect as well. Luckily, we do have a reasonable translation feature on Facebook. As far as the Discord goes, that I don't know if they have a translation feature on the Discord, but that's something that's definitely needed. I wish that that's something that I could personally do, but I took Latin in high school and that was a mistake.
That's understandable. So yeah, so if anyone is on the webinar right now and you
That
want
would
to help in that way, reach out to Timber.
please do. That would be monumental.
So we have some more questions coming through
Yeah.
in the chat. You know, and I think this is an interesting question. So for persons who do not have social media or don't have access to technology, and we know the barriers when it comes to technology usage. How can they be a part of Extra Spoons? Can they get support? How does that work for them?
Right. That's something that definitely needs to be worked on. And that is our flaw. That is our flaw is that it is currently on social media. And I will admit that
Yeah,
straightforward. That is
yeah,
that is the flaw is it is a social media related group. So without an access to technology, that is something that would be very difficult to do. Um, Other than having an inner community support system, we don't have a solid like home base anywhere. We don't have a physical
office.
location
Yeah,
or
okay.
office or anything. No, the physical office is currently my house.
And you're doing so much from it.
Right.
uh, so also someone is asking if they want to donate to your group, and help support your work, where can they reach out? And I'm guessing it's the email that you've provided.
I have not set up anything for donations yet currently because we do not have I mean, I'm sure there will be a need at some point when it comes to moving on to bigger and better things, but I'm currently not asking for donations because as of right now, this is volunteer based and we do not accept any kind of payment for anything because I would like to keep everything level for everyone.
Yeah, that
So this
that
is
makes
there's
sense.
there none of it's myself and two mods, and then our Discord server as well, and we don't accept any kind of payment, and it's running off of Facebook and Discord, which are free to use. So as much as I do appreciate the thought of donating, if you would like to instead donate that to a local mental health organization in your area or somebody that can use that help, I would appreciate that you did that instead for now. But once we are up and running with something a little bit more tangible, do keep us in mind. But as for right now, please distribute those resources to people in need in your area.
Thank you so much, Temba. Um, so uh, Marielle is asking, do you screen for requests? So, for instance, if there is a request for support that may be beyond the scope of what persons within Extra Spoons would provide, so like higher level needs, how do you go about, doing that?
Okay, so that's a little bit difficult because that depends on what that request would be.
Right.
And like I had mentioned, that our group is 16,000 members strong, so we do have a very diverse volunteer base. So when it comes to things that we don't allow in our group, such as medical, financial, or legal help, those people are redirected to the kind of help that they might need. I don't know what specific thing you're kind of trying to ask about as far as help goes, but any kind of emergency situation would be sent to the appropriate source there as far as health goes. But as we kind of we have kind of a set we have kind of a set system of the kind of support that we offer. Um, Things that reach outside of those boundaries, we do try to direct to the resources that they need. And we
Yeah.
do not try to go outside of that scope. And we do not try to offer help that people are incapable of helping with. Even people that are like, oh, hey, I'm a doctor and I can do this. No,
Yeah. That makes complete sense.
no, because it's anybody can say they're a doctor on Facebook.
So I'm seeing people sharing their email about, helping. I would advise, just because I'm seeing, so much messages coming in. If you want to reach out to Timber directly, their email is available at extraspoonsmutualaid@gmail.com. And if it's something specifically related to Mental Health for America, like, getting a certificate of attendance, feel free to email me at kmcintosh@mha national.org, because I just don't want anyone to think that we've missed their email or missed responding to them. Timbo, we just have a couple more minutes again.
That's fine.
And I'm curious, you know, Extra Spoons has been in existence. Forgive me, I'm like, how long have you all actually been in
We hit our
existence?
year anniversary in
Oh,
November 2nd.
oh yay! So 1 year.
One
So
year, 1 year strong.
1 year strong. What do you see being, the next 3, 5 years for Extra Sports? Where would you like the organization to grow? Because it's obviously growing. You've been featured in Upworthy and all these other, publications. So where would you like to see this organization reach?
Onward and upward. I would like this to be more accessible outside of just one social media network. I would like it to be something that, as mentioned before, is not required to have a full-blown account to reach, and
Yeah.
I would like it to have its more standalone capabilities in the
Yeah.
future. So
Yeah.
that would really be what I would like to do, and to have it be more of a standalone organization. That is my goal.
Yeah. Do you s-
Accessibility.
do you see extra spoons being like, cause I think about it, I'm like, I wish there was extra spoons in every county. Like I wish there was like a system set up,
Right.
in every space, um
Right. Yeah, a
that
resource center.
yeah, right,
That'd
and
be
that you
cool.
can able to engage with the community. So do you see it, growing in this way?
Um, I would like to think so. I would love that. That's a big thought.
Yeah, I
That's
think
a big thought. That'd be so cool.
yeah, I wish you all the best. I think this is such a great organization, such a great
Thank you.
initiative. Um and yeah, if I'm just curious if anyone in the chat has any more questions, feel free to post. And if not, just give you all like 2 minutes.
Yeah, that's fine.
Yeah.
No, thank
Okay,
you so
so we're
much for
just
having
getting a
me.
lot of thanks with me chats, and everyone is so happy that this organization exists. So,
Oh,
and I am too. So,
thanks.
yay.
That makes me happy to
Um,
hear.
thank you. So perhaps monthly or weekly. Yeah. So Susan is just suggesting perhaps you may want to have like just monthly or weekly community gatherings, I guess, so that people may connect. So you're getting a lot of a lot of good feedback in the chat
Great.
as well. Um,
Sure.
yes. Thank you everyone so much for being here. And thank you for just being a part of this. Thank you, Timber, for showcasing your organization and the work that you're doing and providing this, I think, vital service to our
Thank you.
communities.
Thank you for
Um,
having me.
yeah, no worries. So I'm posting in the chat again for anyone who wants to receive the certificate attendance for this webinar, feel free to use the link that was just posted, and you will receive a recording of this webinar as well as, again, the link to the certificate of attendance within 1 week. So take care, enjoy your holidays, and have a safe rest of the year.